Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. On the podcast today, I'm joined by our deputy editor, Nick Bostock, to talk about some of the key news stories affecting general practice. Coming up, we're looking at the latest GP earnings and expenses data and what it tells us about GP income for both partners and salaried GPs and regional variations across England. And we'll be doing a quick roundup of some other data published last week on the GP workforce and practice workload. We're also discussing the BMA's recent analysis of the 10-year health plan and looking at some of the union's concerns and whether some of those issues could lead GPs back into industrial dispute with the government in England. Our good news story this week is about the GP workforce in Scotland. Before we start, just a quick message to highlight some new content we've produced on GP Online. Our special report on the government's 10-year health plan and what it means for the future of general practice in England has just been published. The report is available to GP Online, GP Business, MIMS and MIMS Pharma, practice and corporate subscribers and is full of information and analysis about key aspects of the plan. You can find the report on our website at GPonline.com and we'll put a link to it in the show notes for this episode. So Nick, first of all, last week data on earnings and expenses were published. Those data cover 2023-24 and that's the latest year that's available. We talked about this data on the podcast last year as well when it was published, but if people don't know, it is worth explaining where this information comes from, isn't it? Because this isn't necessarily what GPs are earning from their work in the NHS, is it?
That's right. These figures are broader than just NHS income. And that obviously has an impact on how useful they are as a gauge of what GPs actually earn. But they're still a useful benchmark and they're important because what they say is factored into talks on GP pay. So what we're talking about is data on GP earnings and expenses. The figures are drawn from HMRC data from tax returns. And as you mentioned, they include not only NHS income, but also private income. And the data cover earnings and expenses for partners and for salaried GPs, and the purpose of this is to provide evidence for talks on pay between the BMA, NHS England and the government, and it's also part of the evidence that's considered by the Doctors and Dentists Review Body, the DDRB, which provides independent advice on doctors' pay to the government. So that's the key reason really why this data is significant.
Yeah, so broadly, as a whole, what did the 2023-24 data show?
For the 2023-24 financial year, the figures for England show that partners' income before tax bounced back after a really substantial drop the year before. So this time last year, we were talking about the fact that real terms income for partners had dropped by 17% in 2022-23 compared with the previous year. And that's largely because a spike in income over the 2 years before that, linked to COVID vaccinations, had dried up. But the latest figures show that in 2023-24, partners' income before tax rose by 7% in real terms compared with the year before. So it's still well below the level it got to when practices were taking on lots of additional COVID vaccination work, but it has recovered compared with last year. For salaried GPs, income fell slightly in real terms compared with the previous year, despite a 4.3% increase in cash terms. And just as with partners, salaried GP income remains down compared with 2021-22, which is one of the 2 years in which income was inflated by that COVID work. I've just been talking about the figures for England so far, but the data also covers Scotland, Wales and Northern Ireland. And despite the rise in partners' income in England in 2023-24, in Scotland, Wales and Northern Ireland, the changes are much more limited. Scotland's GP partners saw a rise of 1.2% in real terms income. In Wales, it fell by 1.6%, and in Northern Ireland, it fell by 0.6%. Salary GP pay fell in Scotland in real terms, but in Wales and Northern Ireland, it rose.
You've been talking to accountants and other people about this. Is this a true picture of what's going on in practices in England? Because it sounds like quite a big rise, and we're always talking on this podcast about how grim it is in terms of funding in general practice. Why has income for partners gone up?
The feedback I've had from accountants is that the rise in income before tax for GP partners in England, a 7% real terms rise, we said, is a fair bit higher than expected, and it's probably not something that reflects the true picture at many practices. The average figure for GP partner income before tax in England was £158,700 in 2023-24. There's a really big rise in cash terms from just over £140,000 the year before. But there are a number of reasons why that may not be something that reflects the true picture of what's going on with GP practice finances. So one factor is that the number of GP partners in England is falling rapidly, and that's likely to have affected those income figures. There were nearly 400 fewer GP partners at the start of the 2023-24 financial year compared with the start of the previous one. An accountant I spoke to said that there's a marked trend of practices not replacing partners like for like when they leave. So in some cases, practices replace a departing partner with a salaried GP to try and maintain their own income and keep the practice sustainable. And that's an approach many practices have been pushed into because of the erosion of core practice funding over the past decade or so. In other cases, partners can't replace someone who's left, and they're forced to take on more work themselves to cover the gap, and then their pay rises as a consequence of that. Another factor is the way accounting for PCN funding works. That can actually inflate practice profits artificially. The accountant I spoke to, Andy Powell, said that when a PCN makes a surplus, that has to be accounted for in practice profits. So this is money that actually doesn't flow to partners, but it appears in their profit figures and then inflates those income before tax figures artificially. So one other point worth noting is that although, as I said, average GP partner income before tax in 2023-24 was £158,700, the median figure is much lower at £141,700. So what that means is that a small number of GPs with really high earnings are artificially driving up the average. And as we said, these figures aren't just based on NHS income. So an entrepreneur out there who works one day a week as a GP partner and also runs an IT business or something like that on the side and may have a really high income as a result would actually be pushing up that average with that income, which is nothing to do with general practice.
It is interesting that those figures take into account all of that stuff, isn't it? And particularly that they actually use them in contract negotiations, like you mentioned earlier. Obviously, the other side of this is salaried GP income. And as you mentioned, that has stagnated. Is there any reason why that might have happened?
Accountants say there's been a massive squeeze on use of locum GPs and potentially also a reduction in the hours practices are contracting salaried GPs to work. You know, those are the sorts of measures practices have been taking to try and stay afloat because of the erosion of core funding over recent years that we mentioned earlier. And one of the things with these statistics is that they don't differentiate between people working full-time and part-time. So as a result, you can't tell from these figures whether the salaried GP's actual income, what they're paid per hour or whatever, has gone down. All you can see is that on average they're earning less. And the chances are that that reflects actually a reduction in the number of hours they're being contracted to work. This whole issue is something that ties in very much with the shortage of GP jobs that we've often talked about on the podcast. You know, this drive to reduce use of locums and potentially limit the number of hours that practices are contracting salaried GPs to work for.
Yeah. You also looked at regional variation of the data in England. And there are some quite big differences, aren't there? What did that tell you? Yeah,
so to be clear, I'm just talking about variation between regions in England here because the data don't provide breakdowns within other UK nations. As we said, across England as a whole, average income before tax for GP partners rose to £158,700 in 2023-24. But the picture's really mixed across the 7 NHS regions. That's both in terms of the total income now and the real terms gains over the past 5 years, according to some analysis that I did on these figures. There's a 29% gap worth £41,000 between the NHS region where income before tax for GP partners is lowest, which is the North East and Yorkshire region, and the region where it's highest, which is London. And at the same time, real terms income has risen by more than 20% in one region since 2018-19. And there's a bit more detail about, you know, which areas which on our website if people want to go and look. but by as little as 2% in another. So the rate of change from area to area is really widely variable.
Do we have any reasons for why this regional variation is so great?
The theory I've heard from accountants is that it's quite likely driven by vastly different decisions around local spending. Basically, core practice funding, that's the money practices receive per patient through the GP contract funding formula, has been fairly stagnant, or it had been fairly stagnant in the years up to the one we're looking at, 23-24. So that's not likely to be the source of this variation. But ICBs have made really different decisions in different parts of the country on investing in locally commissioned or local enhanced services. These are the services they commission outside of the essential services practices provide in return for their core funding, that basic money per patient. And we reported earlier this year that local enhanced services funding was a postcode lottery for practices across England, with GPs in some parts of the country paid tens of thousands of pounds for a service that's unfunded in another part of the country. And we've also reported on the fact that there's up to threefold variation in the rates of pay on offer for the same work in different areas. So that variation is likely at the root of some of this income variation regionally.
The other thing is that obviously if this data covers work that GPs do outside of general practice, including like maybe other roles they have in the NHS as well as private roles. Obviously, salaries are slightly higher in places like London and the South East than they are in the North East. I mean, even within the NHS, you get paid more for the same job if you work in London because of the weighting. So that probably also has something to do with some of that as well, I suppose.
Yeah, I think that's true. And it probably also reflects sort of variation in opportunities for other sorts of work in different parts of the country as well.
Yeah, definitely. I mean, it might well be there's just plenty more opportunities in London to do some of those other things, whereas there might be less opportunities in different parts of the country. We've discussed, because that's actually one of the caveats with this data. We've kind of talked about that a bit, but you've also mentioned that this is used in pay negotiations, isn't it? The Doctors and Dentists Review Body look at this as part of its recommendations on pay each year. Yeah,
that's right. And so it's all part of what feeds into the negotiations on pay. But I think more than ever this year, when accountants are saying that the top line figures on income before tax seem to show a far larger increase than many practices would recognise from their own accounts. This year, GPs will be alarmed that this sort of data is going into the mix when their next contract's being agreed. Hopefully, when it comes to interpreting these figures, the DDRB will be talking to accountants who work with practices on the ground, specialist medical accountants, who can help them unpick some of the hidden factors that influence these income figures and help the review body understand why they need to be taken, in some cases, with a massive pinch of salt.
Yeah, definitely. Last week was a bit of a bumper week for data, and alongside that expenses and earnings data, the NHS also released GP workforce figures for England and data on appointments in general practice. Just quickly, what did they show?
The main takeaway from the appointments figures was that general practice is on track for its busiest ever summer. We reported recently on figures showing that there were something like 383 million appointments in general practice over the 12 months to June this year, and that was a record total. And July was also a record with 33.6 million appointments in that month alone. Some of what this shows is just that summer is no longer a time when appointments really tail off in general practice. Pressure is continuing all year round. It also reflects the large numbers of appointments being delivered by non-GPs who've come into general practice through the Additional Roles Reimbursement Scheme, the ARRS, in recent years, although appointments by GPs themselves have also risen along with these appointments delivered by other staff. On the workforce, as we've discussed recently, the picture is a bit unclear. Overall figures on the workforce suggest a rise of about 600 full-time equivalent GPs over the past year, but it's not clear to what extent that includes GPs who've come in through the ARRS. I think the government talks about 2,000 additional GPs, but that figure isn't a full-time equivalent figure. It doesn't take account of the fact that some GPs have left those roles, having taken them up in the first place, and at the moment, as we've said, the government, the NHS, are unable to marry up the ARRS statistics with the overall GP figures, although we know there's some overlap. So the actual true picture on how many more GPs we have over the past year is just not clear.
Before we move on, a quick message from our colleagues on MIMS Learning. In-person learning is a vital part of keeping up to date, enabling GPs and other health professionals to learn with colleagues, ask questions of expert speakers and benefit from networking. MIMS Learning's event page gives you details of the general practice-focused learning events, providing you with practical take-home points for your practice, along with CPD certification. Visit mimslearning.co.uk/pages/events to find out more. So Nick, last week we reported that the BMA is preparing for a possible return to industrial dispute by GPs. This relates to those key demands that the BMA gave the government, which we talked about on the podcast earlier in the summer. What exactly is going on here?
This is really about the fact that the clock's ticking down fast towards the deadlines for those BMA demands. Just to recap, the BMA said at the end of July that if its demands weren't met, there are 6 demands, by the 18th of September, then it could go back into industrial dispute with the government. By the time this podcast goes out, there'll be less than 2 weeks left for the government to deliver against these things that the BMA's asked for. So what did the BMA ask for? Its GP committee has called on the government to confirm funding envelopes for next year's GP contract and for the major new GP contract that it's promised to negotiate within this Parliament. And the BMA also wants guarantees around renewal and investment in the GP contract, so undoing some of the erosion in funding over recent years. It wants movement of the ARRS funding into a practice-level mechanism, an emergency scheme to tackle GP unemployment, assurances around GPs leading neighbourhoods, as well as an expansion of clinical negligence cover around data sharing, and that's to do with some of the expectations around data sharing to do with neighbourhoods. So with about 3 weeks to go until the deadline, so about 10 days ago, the BMA said its demands had gone unanswered. So as things stand, we may be looking at a return to collective action or maybe even something beyond that. The first step would be for the BMA GP committee to vote on a potential return to some form of industrial action. And it would then have to move on to a vote across the wider profession. So it's not something that's going to happen all that quickly. And to be clear, this would be a massive step for the profession to take at a time when the BMA is hoping to stay on good terms with the government and negotiate a big new contract. But if the BMA GP committee feels it needs to take this shot across the government's bow, that would possibly suggest it's starting to feel some real concern that general practice might not get what it wants from not only next year's contract for 26-27, but also the big new contract reform coming down the line.
A lot of this discontent and concern, it relates to the 10-year plan really, doesn't it? And concerns about fundamentally what it means for the future of general practice. We've talked about some of these issues in recent weeks, but the BMA published a document earlier in the summer setting out its analysis of the 10-year plan, and it raised some pretty serious worries for general practice, didn't it?
Yeah, we talked before about the BMA spelling out its concerns that the 10-year plan could threaten the existing GP model and continuity of care, primarily because of the focus on a move to working at scale, proposals for large-scale contracts that the plan has billed as an alternative to the traditional GP partnership model. This analysis reiterates some of that. It talks about the BMA's concerns about a lack of clarity, detail offered in the 10-year plan about how large-scale GP contracts could work and how they're going to be funded. And it talks about a significant risk that they could undermine GP partnerships. But it also goes further around the concerns GPs have about the role hospital trusts could have as neighbourhood NHS plans take shape. As we discussed before, one of the concerns GPs had when the 10-year plan came out was that it talks about the possibility of hospital trusts taking on neighbourhood contracts, either across single neighbourhoods, so those are expected to be about the size of a PCN, or across multiple neighbourhoods. And the BMA analysis warns that if this happens, it could actually bankrupt GP practices if hospitals taking on these at-scale contracts strip away some of the work that practices rely on to stay afloat. So that's income for local enhanced services, directed enhanced services, some of the stuff that we were talking about earlier that might be responsible for the regional variation in pay. And there's work that sits outside core income. So that actually reflects a similar warning from the Association of Independent Specialist Medical Accountants about a month ago. Another big concern for the BMA is that hospitals could look to take over practices' patient lists if they take on neighbourhood contracts. So obviously the registered patient list-based general practice is what general practice as we know it is built on. And the BMA wants an explicit commitment from the government that hospitals won't be allowed to take that away from general practice. So if hospitals can take on patient lists and take those away from the core of a GP practice, the BMA says it thinks that would be the end of the current model of general practice. Beyond that, a lot of what the BMA is calling for revolves around guarantees that neighbourhoods will be built on and around existing GP services rather than taking funding away from them. So again, that issue of hospitals perhaps not being allowed to hoover up some of the cash that practices rely on. And it wants a commitment from the government that practices won't be pushed into agreeing to join or to become part of neighbourhood providers before they've even seen what neighbourhood contracts look like or what the money for them is going to involve. I think another major point that stands out from the analysis is that the BMA sees a role for the major new contract for general practice that it wants to negotiate in framing practice's role within neighbourhoods and offering some protection and guarantees for the future. So again, what it all comes back to is how pivotal a moment this is for general practice. Major changes are afoot. There are real uncertainties around how the government sees existing practice fitting into the future NHS, although clearly it's said that it's committed to the partnership model. It didn't say that in the 10-year plan. And this big new contract is going to have to answer a lot of questions around all that.
Probably also worth mentioning here that the BMA has called a special representatives meeting, which takes place in a couple of weeks on the 14th of September to discuss what the 10-year plan means and debate and I guess, decide the BMA's position on a lot of the proposals in the plan. The BMA analysis of the plan that we've just been talking about, that was put together to help inform and support discussions at that meeting. The BMA said it's called this meeting to debate the risks of the 10-year health plan to the medical profession at large and the delivery of safe and effective care to our patients. Now, that statement in itself gives a bit of a sense of where current feelings are about this and perhaps the type of issues that are going to be talked about at that meeting, although we've not actually seen an agenda for that yet. And aside from those concerns you've just discussed there, specifically about general practice, the BMA's also raised other issues in that document about things like the impact the 10-year plan will have on medical training. It's also very critical about the lack of detail on how all of these proposals are going to be rolled out. It raises concerns that the emphasis on tech in the plan to reduce demand and increase productivity is pretty speculative, that it says that it won't do much to address the concerns of doctors working on the front line in all settings in the NHS. It also said that, there needs to be transitional funding to facilitate the move from secondary to primary care, that hospital to community shift the government wants to achieve. But, we've been looking out for anything like that, and there's not really any indication that that's on the agenda. And I think there's also quite a lot of concern from the BMA about the rollout of the single patient record, what that might mean for GP's role as data controller, who's going to have access to that record and the information within it, and how data security issues are going to be managed. So I think there's a lot of specific issues around some of those themes, as well as the concerns about general practice, which will be discussed in that meeting in a couple of weeks' time. So the government, as you mentioned, Nick, has got just under 2 weeks to respond to those BMA demands. And, we know the government wants to negotiate a new GP contract during this Parliament. Work on that is supposed to get underway this month. But all of this, as you've sort of touched on, suggests that relations between the government and the BMA are quite strained. Is this going to make negotiating that new contract harder? What do you think?
I think there's no question that if it comes to the BMA declaring a return to some form of industrial action, it'll make negotiations on that big new contract tougher. Having said that, you could also argue that it may be what the government needs to take GPs seriously. GPs agreed a contract with the government this year after a number of years in which contracts were imposed, and that seemed to point to a reasonably good relationship. But then when the 10-year plan came out, it talks a lot about general practice, but GP leaders said they hadn't been consulted at all on its content. And that suggests the government doesn't much care what GPs think. We also wrote recently about a change to the wording of the GP contract that went further than GPs were expecting. And that also suggests a problem with the relationship between GP leaders and the government or health service officials. When the final wording of a contract that's been agreed with the profession is published, clearly it shouldn't really contain any surprises. But in this case, the wording around a requirement for practices to keep online consultation systems on through core hours, which practices were expecting, came with a further change requiring practices to make sure patients can contact them in person or by phone as well throughout core hours. That's a problem because such a rigid requirement makes it difficult, particularly for smaller practices, to do things like run staff training, for which they might close their front door for an afternoon, for example. But it also means that practices just lose a bit of flexibility around changing, exactly the hours that their front door is open, perhaps to meet local circumstances or something that, that fits with what patients in their practice need. LMCs have said practices should hold off signing updated contracts, or some of them have, which is largely a symbolic move. But again, this doesn't speak volumes for the relationship between GPs and the NHS or government, and it really underscores how tough it's going to be for the profession to make sure its voice is heard as these new at-scale contracts, as well as the revamped core GP contract, begin to take shape.
I agree with you. I mean, I think I've mentioned on the podcast before that it's really difficult to see how the government can deliver on what's in the 10-year plan without a strong general practice, that has decent resources. But I guess the issue that's going to be at the heart of these contract negotiations is whether or not the GP contract is how to do that. Obviously, the BMA would say that investing in the GP contract, investing in existing GP premises, investing in the GP workforce is the key to make the vision in the 10-year plan a reality. They would say that if practices are properly resourced, properly staffed, with enough space, they would be able to do a lot of what the government wants. Clearly, what the BMA wants is to see some sign that the government recognises this and sees the new GP contract as vital to the success of the 10-year plan. That sort of reassurance and language, though, is not really what's been coming out from the Department of Health, is it? I think the fact, you mentioned it as well, I think the fact that the new GP contract, a renegotiated GP contract, wasn't even mentioned in the 10-year plan does make you feel like it's perhaps not as much of a priority for the government as some of the other things in that plan. And, and on the other hand, Wes Street and the government, NHS England, are going to be really keen to show that these new at-scale contracts can deliver a new NHS that's based around neighbourhoods. So there's likely to be a lot of effort going into making them work. So basically, that's the backdrop for these contract negotiations, which, as I say, are supposed to get underway this month. And I agree with you, Nick. I think they probably are going to be pretty tricky. Before we go, we've just got time for our good news story, which is about the GP workforce in Scotland, although it is a good news story with a few caveats. Last week, we reported that the latest official data showed the full-time equivalent GP workforce in Scotland had grown by 4% in the 12 months to March 2025. The increase reverses 3 years of decline, although the workforce remains below the figure for 2019 before the pandemic. There are now 3,591.5 full-time equivalent GPs, an increase of 138.5 during those 12 months. The headcount workforce also increased by 3.2% over the same period. The data also show the GP vacancy rate was down and that the number of full-time equivalent nurses working in general practice increased by 1.5% over that year. So that is generally positive news, but as I say, there are some caveats to this. Dr. Ian Morrison, chair of the BMA Scotland GP Committee, welcomed the increase but warned the government was still falling well short of its targets to boost the workforce. In 2017, the Scottish Government pledged to increase GP numbers by 800 by 2027, and since 2017, the full-time equivalent workforce has risen by just 71. Even if you use the headcount figure, that rise is just under 200. So Dr. Morrison pointed out it would take until 2050 to hit those workforce targets. So Scotland is still very far short of the number of GPs it needs. BMA Scotland highlighted a £290 million funding gap for general practice in Scotland, and also that many GPs north of the border are struggling to find enough work. The data also shows the rise has been fueled by an increase in salaried GPs. The number of partners actually fell over those 12 months, and Dr. Morrison said this could put the future of the partnership model at risk. The Scottish Government has in recent weeks provided a £15 million funding boost to help increase GP recruitment and retention. But as I mentioned, BMA Scotland said the erosion of funding and rising costs over the past 15 years have left general practice facing a £290 million shortfall. So that really all comes back to what we were discussing at the start of this podcast. And it's very likely that that funding erosion is one of the big drivers behind the fall in partners, I would expect. But obviously, there is quite a big increase in the workforce over those 12 months, which is really good news, and it does start to reverse a period of decline. But as the RCGP Scotland pointed out, we'll have to wait and see if this is the beginning of a proper increase rather than a one-off jump. Well, that's it for this week. Thanks for listening, and thanks to Nick. I'll be back next week, so please do join me then. In the meantime, don't forget you can keep up to date with all the latest news affecting general practice and access lots of other resources on our website at GPonline.com.